Hello, everyone. Welcome back to MJ Pharma. In today's video, we're going to discuss a crucial topic that could potentially save lives: antidotes for drug overdose and poisoning. We'll be covering a wide range of substances and their corresponding antidotes. So, without further ado, let's dive in. First up, we have carbon monoxide poisoning. The antidote is 100% oxygen, often administered in a hyperbaric oxygen chamber. For various substances like alpha-2 agonists, antimyasthenic agents, and nerve agents, the antidote is atropine sulfate. In the case of black widow spider envenomations, the antidote is black widow spider antiserum. Moving on to foodborne botulism and certain poisonings, the antidote is botulinum antitoxin. For medications causing neuroleptic malignant syndrome, bromocriptine mesylate is the recommended antidote. In cases of lead and zinc salts poisoning, the antidote is calcium disodium EDTA. For hydrofluoric acid skin exposure, calcium gluconate gel is the antidote. Calcium gluconate INJ is the antidote for calcium channel blockers, fluoride salts, hyperkalemia, and hypermagnesemia. In cyanide poisoning, the antidote is the cyanide antidote kit or methylene blue. For serotonin syndrome, the antidote is cyproheptadine. Malignant hyperthermia or muscular rigidity can be treated with dantrolene sodium. Iron poisoning calls for deferoxamine mesylate as the antidote. When dealing with chloroquine and related antimalarial drugs, diazepam is the antidote. Digoxin immunefab is the antidote for cardiac glycoside-containing plants, digitoxin, and digoxin. For arsenic, copper, gold, lead, lewisite, and mercury poisoning, dimercaprol, Bale, is the antidote. Diphenhydramine HCl is the antidote for drug-induced extrapyramidal symptoms. In cases of penicillin and cephalosporin-induced anaphylaxis, epinephrine is the antidote. Ethanol is the antidote for ethylene glycol and methanol poisoning. For benzodiazepines poisoning, flumazenol is the antidote. Folinic acid, leucovorin calcium, is the antidote for methanol, methotrexate, trimethotrexate, and pyrimethamine poisoning. Fomepizole is the antidote for ethylene glycol and methanol poisoning. In cases of beta blockers, calcium channel blockers poisoning, glucagon is the antidote. Insulin, regular insulin, is the antidote for beta blockers and calcium channel blockers. L-carnitine is the antidote for valproic acid-induced hyperammonemia, encephalopathy, and liver failure. Methylene blue is the antidote for methemoglobin. N-Acetylcysteine is the antidote for paracetamol, carbon tetrachloride, and other hepatotoxins. Naloxone is the antidote for opioids, alpha-2 agonists, and imidazoline decongestants. Octreotide acetate is the antidote for sulfonylurea hypoglycemic agents. Phentolamine mesylate is the antidote for catecholamine extravasation and intradigital epinephrine injection. Physostigmine salicylate is the antidote for anticholinergic alkaloid-containing plants and certain medications. Phytonadione, vitamin K1, is the antidote for coumarin and indandione derivatives, long-acting anticoagulant rodenticides, and warfarin. Pralidoxine chloride is the antidote for organophosphate poisoning. Protamine sulfate is the antidote for heparin and low-molecular weight heparin, LMWH. Prussian blue is the antidote for radioactive cesium and thallium poisoning. Pyridoxine is the adjunct therapy for isoniazid and ethylene glycol intoxication. Scorpion antiserum is the antidote for scorpion stings, and snake antivenom is used for snake bites. Sodium bicarbonate is the antidote for chlorine gas exposure, hyperkalemia, and certain poisonings requiring serum or urine alkalinization. Thiamine is the antidote for ethanol and ethylene glycol poisoning. Urine alkalinization, dialysis, and activated charcoal are the interventions for barbiturates, phenobarbital, and salicylates poisoning. Remember, the information provided in this video is for educational purposes. In any emergency, always seek professional medical help. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends, and subscribe for more informative content. Stay safe, and until next time, take care.